Hip pain at night, causes and prevention. Lateral hip pain is the broad term used to describe pain felt on the outer side of the hip. Pain can begin suddenly or develop gradually over time. Many people experience hip pain at night. Hip pain is more common in women than men and is most prevalent in women aged 40 to 60 years. It is mainly caused by injury or overuse, although there are some other causes. In this video, we take a look at these causes and some tips for preventing hip pain at night. Common causes of hip pain at night. Hip pain at night can be caused by a variety of different conditions affecting the hip joint, connected muscles, or surrounding tissue. Greater trochanteric pain syndrome. The muscles around the buttocks are called the gluteal muscles. Poor strength in the gluteal muscles can cause the front of the hip to overcompensate to stabilize and support the rest of the joint. This causes the tendons attaching the gluteal muscles to the hip and pelvis to become squeezed, leading to pain at the hip known as Greater Trochanteric Pain Syndrome or GTPS. Greater Trochanteric Pain Syndrome specifically involves the tendons and fluid-filled sacs surrounding the greater trochanter, which is the prominent bony part of a hip. An injury to either the tendons or sacs can cause pain and tenderness to the hip, particularly at night. Bursitis. Bursae are small fluid-filled sacs that act as cushions, helping to reduce friction at the hip joint. Bursitis occurs when the bursae become inflamed. Inflammation of the bursae causes pain from the hip that spreads down the side of the thigh. This sharp, intense pain may worsen at night. Tendinopathy. Tendinopathy refers to any disease of the tendons. Tendons in the hip attached the gluteal muscles to the hip and pelvis. Together, they work to stabilize the pelvis and support hip mobility during day-to-day tasks, such as walking and going up the stairs. Tendons in the hip may become inflamed or break down due to compression or overloading without having time to recover. This can cause hip pain at night. Frequently sitting with legs crossed or standing with all the weight on one hip can also cause tendinopathy and hip pain. Osteoarthritis. Osteoarthritis of the hip joint is another common cause of hip pain at night. Osteoarthritis is a result of age-related wear and tear of the tissue known as cartilage that surrounds the ends of bones. As the cartilage at the hip wears away, the bones at the hip rub against each other, which leads to inflammation, swelling, and pain. Osteoarthritis can present as stiffness and soreness of the hip, which can make everyday tasks difficult and painful over time. Hip pain can move around to the buttocks or down the leg, affecting mobility and can be painful at night. Exercise-related causes. Strenuous exercise such as soccer, running, or dancing has been linked to increased risk of hip pain. This could be due to a range of conditions, including bursitis, tendinopathy, or injury to the iliotibial band, a band of tissue connecting the pelvis and the shin bone. A recent change to the frequency of exercise may also be a trigger for injury or pain in the hip. Other causes. Several other factors could lead to hip pain occurring at night. Age. Both osteoarthritis and trochanteric bursitis are more common in older adults. People transitioning to menopause and postmenopausal women are also at greater risk of hip pain at night. Overweight and obesity. People who are overweight or obese are more likely to get osteoarthritis as their joints have to deal with more pressure from increased body weight. Accident or injury. Hip pain at night can be brought on by an injury that dislocates the hip joint or an accident such as falling over. Pain from the knee, pelvis or back. A person may feel pain from other areas of the body in the hip. For example, pain in the back caused by pressure on a nerve. There can also occur in the hip. Hip pain at night during pregnancy. During pregnancy, it is quite common for individuals to experience changes in their body and hormone levels. One potential change is a pain in the hip or pelvis as muscles and ligaments relax and stretch before giving birth. When pregnant, the best sleeping position is on the side. Experts recommend putting a pillow between the legs, which can help support the hips and lower back and prevent rolling over. Other less common causes of hip pain during pregnancy are a tear in the ring of cartilage that cushions the hip joint and holds the ball and socket joint together. Mending this tear might require surgery. A hernia, where an organ or tissue pushes through a weak spot in the surrounding muscle or tissue. Added pressure on the abdomen during pregnancy could cause a hernia. Anyone who is concerned about hip pain during pregnancy should tell a doctor or make an appointment to see a physio. Prevention. Here are some steps that people can take to reduce the risk of experiencing hip pain at night. Avoid repetitive activities that put a strain on the hips. Lose weight if overweight or obese. Maintain strength and flexibility at the hip joint by exercising safely. Make sure to wear appropriate footwear when exercising. When to see a doctor. People should seek medical attention if hip pain at night is persistent, gets worse, or spreads to knees, pelvis or lower back. If someone is taking non-steroidal anti-inflammatory drugs for long term, but the drugs no longer help ease the hip pain, the person should make an appointment to talk with a doctor about alternative medication options. For a thorough diagnosis of hip pain, it is likely that the doctor will order an imaging test such as an X-ray to look more closely at the hip.